this Lunch and Learn, you will learn about osteoporosis and how to increase bone density, weight-bearing and balance and flexibility exercises, cardiovascular strength training guidelines, and I've known Margaret for over 10 years, and she has been my physical therapist, and she is a very outstanding physical therapist, very knowledgeable. She is also very thorough, and she is very patient-centered in her assessment of you and treatment of you. So I will present Margaret Bronson from Parkview. Thank you.
Can you hear me? Everybody in the back, is that a good volume? Okay, just if you can't, and I'll adjust. My name's Margaret Bronson, and I'm a pelvic floor physical therapist, women's health physical therapist, but I do treat men specifically for pelvic floor. My interest in osteoporosis came early on in my career, long before I got into pelvic floor physical therapy. When I did my thesis in 1996 on the effects of strength training on osteoporosis. In that study, we had women with multiple compression fractures, which we'll talk about here in a second, in our study, who were average age was in the 80s and 90s. And we had them going through exercise programs 3 times a week, and it was about for half of a year. And then at the end of the study, we did show some improvements in bone density and strength and posture. So it was from those early beginnings that got me interested in osteoporosis. And certainly over the years, that's over 20 years, we've seen some changes, but also some changes in the treatment, the medical treatment of osteoporosis as far as the medications. And we can kind of touch on some of those. But one thing that has stayed true through all these years is the importance of strength training. So I'm very proud to be a physical therapist because our stuff still works. so that I'm really happy about that. And it's something that all of us can do today. So we have some control on our outcomes. So what I wanted to do is first start with kind of like a little mini quiz. There's a lot of people, and I think I made about 35 copies, so some of the people in the back may have to share. And I know Patty and the wellness group will provide copies if you need copies for that. But if you could, the thing that's flipped upside down is your quiz. So this is kind of like a pre-test. I'll try to have you do it just kind of quickly and on your own, so there's not too much mumbling, but go through that. There's 5 questions, and I'll read the questions out loud for the sake of the camera, just so that we can kind of go through that, and then you guys answer that. We're going to just do a show of hands at the end quickly so I can determine the winner because I've got a small prize. So the first question is know your T-score. So match the T-score to the appropriate bone condition. We've got a negative 2.5 or lower, a negative 1.0 or higher, and a minus 1.0 to minus 2.5. And the things you can choose are either normal bone, osteoporosis, or osteopenia. So pick that. Okay, the next question. Which areas are most affected in osteoporosis? You can select more than one, so I want you to circle all of the ones that you think are appropriate. We have to choose from spine, ankles, skull, wrists, fingers, knees, toes, ribs, elbows, hips, shoulders, and jaw. So you can choose what you think. The next question. Which exercises are best for osteoporosis? These are all good exercises, possibly. And choosing from biking, aerobics, hiking, elliptical, swimming, walking, scuba diving, arm ergometer, tai chi, dancing, hang gliding, or strength training. And you could choose more than one. Number 4, which risk factors Oh, that's a terrible sentence. I'm sorry. I wrote this quite late. Which are the risk factors for osteoporosis? You can, again, select more than one. Female gender, slim build, alcohol use, over 30 years old, Caucasian ethnicity, history of cancer treatment, family history, smoking history, and long-term steroid use. And the final question, true or false? You can circle true or false. You will know you have osteoporosis since you will have pain. Okay, so we're going to go ahead and do some quick answers. As far as minus 2.5 or lower T-score, is that osteoporosis, osteopenia, or normal? Just a little. Osteoporosis? Yes, correct. So osteoporosis is minus 2.5 or lower T-score. So if your T-score, that's what you get when you get a DEXA scan. You get a T-score. Your T-score is the score. So your DEXA is kind of like an X-ray for the bones. And your T-score is the number that they give you. And it's basically a number that compares you to a 30-year-old with normal bone or in that normal bone area. So it's basically how far are you away from that normal. And so if you have a minus 2.5 or worse, then that's osteoporosis. That's definitely something to be concerned about. If you have a minus 1 to minus 2.5, that's considered osteopenia. Osteopenia is the precursor to osteoporosis. So osteopenia is where your bones are starting to degrade. In osteoporosis, they're a lot more fragile and they're at a much higher risk for fracture. So if I think about an osteoporotic bone, we would think about if I was looking at this vertebrae here in the spine, so an osteoporotic bone would almost be like if you think of a foundation that has a lot of termites or a piece of bone that's had a lot of termites, it could crumble and compress. And that's one of the things that can cause that sort of that humped over posture because each of these vertebrae kind of compress. And that's kind of like a fracture. So number 2, which areas are most affected in osteoporosis? I was looking for mainly 3. We're talking about the spine, the hips, and the wrists. Some of those other areas are associated. Sometimes someone will have a rib fracture and not know why, then go in and get a DEXA scan and find out they have osteoporosis. Or sometimes they'll have something with their jaw. Sometimes you hear things with the jaw with some of the medications, but that's a whole other topic. But mainly those 3, the hips, the spine, and the wrists, those are the things that we're going to focus on here today on areas we can affect with our exercises. So number 3, which exercises are best for osteoporosis? Again, we're thinking about which ones are best. All of these may be wonderful. The ones we want are things that are weight-bearing exercises. So on this list, aerobics would be okay. Hiking would be okay, walking would be excellent, Tai Chi would be good, dancing would be good, and strength training would be good. So those would be the ones that we would want. All those other ones may be okay. Hang gliding, I would say, if you have osteoporosis and you're hang gliding, I don't know, if you fall, I would be worried that maybe you break something, but I guess you gotta live, right? Which are the risk factors for osteoporosis? This was all of them. So all of those are risk factors. And then finally, you know you will have osteoporosis if you have pain. True or false? False, correct. It's silent, especially at the beginning. A lot of times people don't know they have it until they have a hip fracture or a compression fracture, or they sneeze and they have back pain and they find out they have that. So this is why this is so important, because a lot of times we don't even get DEXAs, maybe even into when we're 65, unless our doctors are interested in this. So this is something that we need to be on top of right now and know what we need to do for the long term. So we'll talk about that. So did anybody get everything right? Hands up. Did anybody get 4 out of 5 right? Okay. This is not just because it's close, but kind of it is. So there's your wonderful gift. Gracias. There's a TheraBand in there and a little information on osteoporosis. So. The booklet that I threw in hers is something that you can download. It's on the government website. It's on www.bones.nih.gov, and there's like a nice guide for bone health and osteoporosis that kind of incorporates a lot of good information, and that's available on the website. So we're going to go ahead and talk about osteopenia and osteoporosis. So basically, like muscle, bone responds to exercise by becoming stronger. So that's an exciting thing about bone. Young women and men who exercise regularly achieve greater peak bone mass than those who do not. And typically, we see our peak bone mass in our 30s, in our third decade of life. And after that, especially women, we begin to lose bone, obviously with loss of estrogen with the menopause. During menopause, we can have up to 2 to 4% of decline every year of menopause. So this is why it's really, really important to be thinking about this beforehand. So I'm 48 years old. So this is, if I haven't been building bone up till now, I really need to be doing this because I know there's a slide in the works. so that's something that we need to be considering, because the higher you start, the higher you're going to end. So that's really important because we want to be as high as we can at the end of that so we can prevent bone fractures as we get older. So again, how do we prevent bone loss? One of the ways is through exercise. Exercise improves our muscle strength, it improves our coordination, it improves our balance, which also can help prevent falls, which if we do happen to be a porcelain doll and have a minus 3.0 T-score, if I don't fall, even though I'm osteoporotic, I'm not going to have a fracture. So, or not going to, but hopefully not. So this is very, very important for us to exercise. So basically, there's a lot of different principles of exercise that are important when we talk about both muscles and bones. Specificity is basically, when we exercise, we want to target the bone site of interest. So we want to think about wrists, spine, and hips. And those are specific exercises we're going to talk about. We want to contract the muscle. So in our body, our muscles attach to bones. And so when we contract, so if I contract my bicep and move my arm through range of motion, where it attaches, I get more bone density depending on how heavy I'm lifting. So basically, if I lift enough weight to make the muscle pull so much that it kind of injures the bone underneath, that's where I'm going to build bone. So that's what we want to do. So we want to be very specific to the areas where our T-score are deficient. Overload. So basically, again, as much as these are really cute, maybe some people, this would be enough. But for most of us, if I was, again, go back to my bicep, and I could do this all day long, it's just range of motion exercise. It's really not a strengthening exercise. This doesn't constitute, if I'm taking, something that's heavier, and I do that maybe 10 times, and whoa, that's going to build my bone better than that. So we have to think about that as we progress. We can't start with that, but we truly need to be thinking about this as a long-term project. It's just like, you're in education, so I guess it's just like education. If we taught everybody at third grade level forever, would we truly be learning? No, we have to keep achieving a little bit higher, all the time and build on our learning. Well, this is building on our strength. So that's really important. Now for bones, also doing things like weights are good. There's also some devices like weighted vests. So we can talk about this as I go into the area a little bit more, but I'll kind of talk about this because I always get lots of questions on this. I promote weighted vests a lot, especially because when I'm taking care of patients and we're talking about osteoporosis, if the patient is about 117 pounds or less, I always think about it like they're walking on the moon. Like gravity doesn't affect them the same as they do. I'm nice and solid, so it affects me, a lot more. When I walk on the ground, I get my, forces back pretty good. But if I was 100 pounds, when I walk on the ground, the forces are not going to be as strong to my hips. So basically, a weighted vest, what that does is it kind of adds weight to you so that when you're walking, you have more weight going into the ground, creating more ground force back up. So kind of thinking back to our physics days. Reversibility. Basically, in absence of a training stimulus, your benefits to bone density will be lost. Another way to say this, if you don't use it, you'll lose it, right? So basically, this is the truth. So if I'm really good and after I go to this talk and I'm like, I'm gonna do it, and I do all the things, I do my exercise, and then for whatever reason, next year something happens and I don't do anything, I literally lose all the gains. So the problem is you have to keep doing this. So you can't just stop. You have to continue, and we're going to talk about the frequency, but 2 to 3 times a week is what we're looking for to keep improving bone density. So initial values. For those of you who may know your T-score, the ones in this room with the lowest T-score will have the most to gain. So if you're a -3, you'll probably show some good gains by just starting, doing something. If you're a -1.2, you might gain a point, but you're not going to show as much improvement as the -3 person. But that's okay. But that's the thing is, so the people who have the most to gain are the ones with the lowest scores, and those are the ones who have to do this. One's peak bone mineral density is determined by genetic makeup. So again, as well as diet, activity, medications, and whatnot. So again, if you have a grandmother, an aunt, or other people in your family who have osteoporosis, look closely at that because, you probably need to be doing something about that today. You can't change that, so just it is what it is. If there's a lot of osteoporosis in your family, you really need to be considering seriously working on your bones. Also, modifying the factors we can modify: smoking, alcohol, diet, exercise, those kind of things. Those are things that we can actually do. So basically, exercise recommendation, and again, this says postmenopausal women because I do this talk a lot of times for women, but men do get osteoporosis, and especially in conjunction with some medications, steroid medications, cancer medications, genetics. So they're not excluded from this. It's just 4 times more likely in women. Women also tend to be lighter, so that puts us a little bit more at risk, while men have more muscle mass, which helps to improve bone density. But all of us, to improve bone mineral density, number 1, weight-bearing activity. So when we're doing our cardio and we have a choice between the bicycle, the elliptical machine, or the treadmill, if we're thinking about our bones, we choose the treadmill. I love to bike. It's awesome. It's great for the heart. Go ahead and bike. But then you still got to do the treadmill. So if we're thinking about the bones, we're talking about the 45 minutes 6 days a week is for the bones. So I have to do 45 minutes for the bones, and then I do my bike for fun, or I do my bike for my race, or whatever. Or I do my swimming for my fun, or my race, or my heart. But the reality is for the bones, I have to do that 45 minutes, 30 to 45 minutes, but I always aim for 45 minutes. If you're light, especially at the beginning, again, you want to get your time up to that 45 minutes. But then once you get that, add some hills if you can find them. If you have a treadmill, you can add an incline or a weighted vest. And you can buy these weighted vests on Amazon, Dick's Sporting Goods, or whichever store that you like. They come in lots of different sizes, different price ranges. Some have mesh on them, some are heavy, but typically I like to start at around 10% of your body weight. So if you're 100 pounds, you're about 10 pounds. If you're 150 pounds, you would do a 15 pound. So something like that. If you're 200 pounds, you probably don't need it right away, but if you want to use it, you could, but I still would probably go more starting at the 10 or 15 first, get yourself used to it before you do go to the 20. Some of them have like adjustable weights where you can kind of put them in your pockets. There are some that are built for almost like the boot camp type style, especially for the men, where they go in even heavier weights than that. And again, but you want to start a little bit low and then you can go up. But most of my female patients end up in between 10 and 15% of their body weight, and that's usually enough. And they use this for their 45-minute walk or exercise activity. Then strengthening activity you want to do in addition. So we got 45 minutes, 6 days a week. And then we've got strengthening activities 2 to 3 times a week. So if you have a gym here, you go to the gym. We're going to go through specifically what we're going to do at that gym. So again, there's many exercise equipment in the gym. What we're talking about for the bones is just a few. So what you could do for those 2 to 3 times a week are just these few exercises we're going to talk about. If you still want to do the bicep curl, you want to do this, you want to do that, those are all fine. You could still do those, but we want to do these. This is like our entree, our main thing. We have to do this. So if we say Monday and Thursday are my bone days, I'm going to do these exercises on my bone days. The rest of the week, if you want to do more stuff, that's fine. You know, everybody's like, well, I go to the gym 5 days a week. That's excellent. Just 2 days, you're going to do this. Focus on the spine, hips, and wrists. We're going to talk about that here coming up, but spine, hips, and wrists. Overload, again, less reps, more weight. So again, this is right at the beginning, if you've never exercised before, of course, I'm not going to expect you to lift super heavy weights. But the reality is again, just like that 2-pound weight, this is not going to cut it very long. So it's a good way to get started. Make sure you don't get injury. Make sure you can do it correctly. But then you need to be doing the bigger weights. Reversible. Don't stop the exercise routine once it's started. Again, if you don't use it, you lose it. So once you get going on this, you do, you know, if you have a week you can't do it, that's fine, but you got to get back to it right away. So you got to start thinking about this, about helping your bones. And again, the weakest clients have most to gain. And then if you're blessed with a genetic predisposition to osteoporosis because of a gift from family members, I think you need to do this. So you don't have much other choice. So posture and balance. Another area that's important. So again, if you have osteopenia or osteoporosis and you fall, you could be at risk for fracture. So again, we need to think about posture. The better your posture, the less likely I'm going to fall, because the more forward my posture, now my center of gravity is forward and I have more of a chance of falling. So these are things that we want to do. It's the better our posture, the better. The other thing about posture, and again, this goes back to my thesis back in the 90s. But again, we measured the curvature of these ladies' backs because they had back pain and they had multiple compression fractures causing that spinal deformity that we mostly associate with osteoporosis. So this lady, this posture that she has, that, you know, you can kind of picture, you know, she's sitting there, maybe she has to use a walker because she's so far forward. You know, it creates a lot of things. It affects her lungs because now she doesn't get full lung capacity because she can't breathe. You know, maybe she can't swallow because her throat is closed off. Maybe she has issues with her digestion or her bowels because she's, you know, closed into that position. But some of this is due to the structure in the spine, but some of it's because of the muscle. So your head weighs about 15 pounds. So how is she holding her head up? Well, she can't, because over time her back muscles have gotten so weak, just letting her go there. If we get on top of this now, we keep these strong, even if we were predisposed to some of this foundational problem, we're still going to have the strength to hold up that 15-pound head. So that's the thing that we want to think about, is what do we have control over? And we definitely have control over being able to hold up our head, but we have to work at it. And all our desks, we talk about a long time about, and I have a whole other talk on sitting is the new smoking, sitting posture and this whole thing and how terrible that is. And we do need to stand during our workday. And ideally, I like to tell people, if you have an hour of work sitting at a computer, half an hour of it should be standing. And that's not always easy to do. Some of us have sit-stand desks, all of us don't. So we have to kind of think about that, but how do we incorporate getting up, getting moved? I mean, some of these devices, this thing buzzes at me, tells me to move. I'm in the middle of a consult with a patient and I have to be like, oh, I better stand up and stretch and then sit down again. But those are good devices, ways to use technology to help us to do the things we should do. Contraindicated exercises. So again, jumping. Now, in theory, jumping is a good exercise to build bone density because I'm creating forces on the ground. However, if I'm prone to stress fractures or I'm not ready, I'm not jump trained, I'm not already a runner, this might not be the thing I want to start with somebody. So oftentimes I'm like, yeah, but I want to do for fitness. Okay, I mean, if you're already running, that's the kind of thing. But if I'm just meeting you for the first time, you've never exercised and you want to all of a sudden do that, I'd rather you walk it, get your strength up first. but we definitely don't want to risk compression fractures. And if you're in the minus, high minus 2.5s to 3s, I don't know. I would question what benefit are you going to get from it. Crunches and sit-ups, anything that brings forward flexion can increase compression fractures, so I don't love those. And anything that pulls the neck forward is going to help promote that forward head posture. I don't love that. So we want to be thinking tall. We want to be thinking nice, strong back, and that kind of thing. Okay, so as the program, and this is all outlined in your handout, so this will help you to remember what to do. And then we're going to go through a few demonstrations here. But walking, so we're talking about 6 days a week. So again, we want it to be brisk. So when I have my activity tracker here, so I'm going to just jump to a different handout that you have. You have a handout that's called Physical Activity and Improving Health. This is a World Health Organization worldwide promotion of physical activity. And basically what we are recommending for people for our physical activity and for disease control is 150 minutes of moderate intensity a week, or 75 minutes of vigorous intensity. As you can see, my numbers are a little bit higher for the bones. The reality is with this document, this is just a start. Further research has shown that if we actually want to reverse some of these chronic diseases, we're actually talking 300 minutes of moderate intensity and 150 minutes of vigorous intensity. So that's daunting. So like again, even devices like what I have on, they have the 150 minutes already built in, that when I do my walk, I turn it on and I count, so I can make sure I keep track of 150 minutes of activity a week, and I have to get into a certain heart range in order for it to count. So, so again, technology is out there to help us to get some of these goals. But I didn't make the rules up. This is just what it is. So we all have to do it. So I'm just like, oh, I don't know. It's interesting because, you know, as we make our world so much easier, things that should be basic are like, oh, I can't walk. Why is this so hard? But anyway, I don't know. That's again, a whole other discussion. But again, hills, stairs, treadmill, incline, things like that. We want to think about adding that resistance to our walk to make it more difficult so that it can actually increase our bones. And again, the weighted vest. And that's a picture of a lady with the weighted vest on. So when we're talking about exercises, and I will have Patty, if that's okay, come on up, and I'm going to demonstrate these as we go just to kind of keep us in line. So lat pull down. So these are the specific exercises we're talking about. So we're first going to talk about the spine. And literally, we want to strengthen the spine, right? Because we want to be specific, and we want to strengthen the hips. So this is an exercise for the spine. And this is for the latissimus dorsi, which is this big muscle. So again, the nice thing about some of these exercises, they're big bang for your buck exercises. They get a lot of things. What is nice about this is that we're getting everything that this muscle attaches to is going to be increased bone density when we strengthen it properly. So that's what we're going to do. Now, we don't have a lat pull down machine in here, but if you want to grab, throw around a few of these bands, and maybe a few people, if they want to try it in their spot, they can. So I'll show you what to do. So you'll kind of have to have a partner help you. So one of your neighbor will help you if you want to try some of these. And I'll be Patty's neighbor. So you take whatever. If the lighter colors are the easier colors. Yeah. Yep.
Start off easy.
Yeah. So again, we're just trying to get the motion here. So with this band or bungee cord, you would attach this to, like, let's say the top of a door or something like that, put a knot in it, close the door, or you would do a machine. So I'm going to hold it up like this, and then I'm going to have her pull correct. And see how she's pulling her elbows back, yep, and towards, so she's thinking in and down with her shoulder blades. Yes, beautiful. Perfect. And what we would aim for is maybe 10 to 12 reps, and that's it. So at the 10th to 12th rep, she's going to be like, oh my gosh, this is so hard, I want to stop. That's where we know we're good. So that's how much weight. Now, she could do this all day long, so we know this is not enough. But that's what we're talking about. So when I'm at the gym and I'm choosing a weight, I might want to do, okay, so if I do 60 pounds or 70 pounds and I do that, and if I think I could do this for 30 reps, it's too easy. The next time I go, I'm going to have to do it a little heavier. So on those 2 days a week that I'm doing my bone exercises, I go to this machine, I do it hard. But if I'm doing the circuit other days of the week and I want to do a little bit lighter because I want to do whatever, that's fine. But for bone days, you want to do it a little bit stronger. Once you've got the hang of it and you know you're not going to injure yourself, but you want to build those bones. So that's going to be the lat pull down. Okay, stay there, Patty. Seated row. Again, those people who have the bands, you can certainly try this. Grab your band again. So again, there's machine. You can do the machine at the gym so that you could sit, you could stand, whatever, or you could use a bungee at your desk at work. Again, you would attach this more lower, probably on the door handle. So do that. And again, right now we're just picking the weight that we have. And again, her elbows are going to be in at her side. She's still going to squeeze her shoulder blade together. And good. And then you're going to keep your shoulders down. Yes. So you see how she did that? Because sometimes we want to use our upper traps, which help. We already use those all day long in our work. So we want to pull our shoulder blades in and down, but keeping the elbows in at her side. Perfect. Good. And again, 10 to 12 reps. The last few reps, she hates me. That's where we want to be. So you want to feel like you did it. And this gets the rest of those muscles that are above there. So with all of those, we've pretty much got everything below the C-spine down to the sacrum. So we've just affected all these bones by doing those 2 exercises. So you see how it's not that hard? Truly, a lot of people, even if they don't have a gym membership, if they go to one of these, $10 a month places, or you have a gym at work, it really doesn't take long. It takes you about 10 or 15, maybe 20 minutes max to do the 2 days a week stuff. And then you could do your other days with your walking or whatever. So it's not a big investment, but it's just something that we have to do because we don't lift that much. So that's those ones. Okay, next, prone back extension. This one here, do you mind laying on the mat? Okay, but we'll have you facing sideways. Yes.
May I ask you, does it matter in which order
Nope.
you do these exercises, before walking or after walking?
Nope. Some people, if you're going to be that picky, we don't have time for being that picky, right? Really, Yes.
Should you have some kind of aerobic to get your muscles warm before you do these?
Yes, I mean, generally, 5-minute warm up. By the time you get dressed, I don't know about you, but by the time you get dressed, I'm warm. If you walked into the gym from your car, that kind of thing. I mean, it doesn't have to be a significant warm up, but yes, you just generally want to be warm. If you want to do a few general strengthening exercises as your warm up, you can do that. A few bicep curls, these kind of things, and then do that. Again, that's fine. But again, this is the time intensive. What do I need to do to build my bones? This is like these are your pills. These are your vitamins, your exercise vitamins. So in my study that I was working on with a lot of my patients, they could not lay on their stomach because again, they had a lot of that structural flexion. So if you can lay on your stomach, that's a good sign because we know that you're somewhat straight. I'm going to have you, Patty, put your arms behind your back or next to your spine if that's fine. Yes, perfect. Palms facing up ideally. And then just go ahead and lift your chest off the mat. Nope, sorry. This part, lift it. You got it. Yep, you got it. And then down. And then lift up again. Good. So there she's doing some thoracic extension. So this is getting all the way from there. So her very tiny spinal muscles next to her spine. And again, with our older ladies, we did put a weight on here eventually. You don't have to certainly start with that, but this is something very simple to do.
How long do you hold it?
Just for a few seconds. She said, how long do you hold it? Just for a few seconds. This one here, you do like maybe 10 to 15. You don't even have to do that many. But if you did this, you could even do this one more often than twice a week. You could do this, 4 or 5 times a week. But it's just, again, something that we never do. You wouldn't believe how many people never lay on their stomach. And again, we're not supposed to sleep on our stomach, but we do need some time, in different positions. Yes. Okay.
12 reps again.
Yep. That's a good one. We'll leave that there. Okay. So we've got the spine, right? We're done. 3 exercises, we're pretty much done the spine. Could you do other exercises for all these things? Bent over rows, of course, there's all these things. But this is our first visit. just make it simple, do some things. Leg press. So this is basically your front of your legs, your quads. So for our hips, we want to think about the muscles that attach to our hips. So we're thinking quadriceps, which are the muscles in the front, glutes, and hamstrings in the back. Basically, if you do those, you're good. This one picture, I put it on there, and I keep thinking I got to take it off. But once in a while, I have someone who's quite weak. So maybe they had a knee replacement surgery or something, so they can use the band to push. Most of us can get out of our chair, so I can lift my body weight, so that's almost way too easy. So a leg press at the gym just looks like that, so we can't demonstrate that here, but that's just literally that. If I was to choose my weight on my leg press, technically I could pick my weight, but I would probably bring it down a little bit. So maybe I'd start at 150 pounds and see if I can push that, and then I could go up to my weight. So something along those lines. And again, you want to adjust yourself so that you're comfortable, that your legs are proper, but getting that. And again, 10 to 12 reps, not a lot. A squat. I will have Patty come here because there's lots of different ways to do squats. And again, you could talk about this for hours on end. So if we talk about a squat here, we're literally basically feet shoulder width apart. Yep, and then I like to add breathing, inhale, exhale. As I exhale, my belly draws in, your butt goes back, and you're gonna go ahead and squat and come back up. And we can be really picky on form, go ahead and do that again. But in general, if your butt is coming back here and your knees are staying behind your toes, you're gonna get more of the back. Correct, yep. And you can, again, if you have personal trainers, you can work on, this is one of those areas where you can work on with someone to get proper form so that you don't injure anything. But in general, and you have that here, don't you? Mm-hmm. Yeah, where you have different people. So that's one that definitely having some guidance does help. But a squat is a fantastic exercise because there's lots of different ways for 6 weeks you can do it this way, then you can do it with a ball behind your back, then you can do it with a ball between your knees. So there's all sorts of different ways that you can kind of change it to keep making your muscles work so that you can really build the bone on your hips. You can add weights. You can use a barbell. You can use dumbbells. You can use your own body weight to start. These are all different ways that you can add to your squats. There's Smith machine squats in the gym that you can do. That all of these can help strengthen that. Okay. All right, we're pretty good on time here. Lunge. Okay. Come here with the lunge. So again, some people like lunges, some people don't, but again, it's another nice, good global exercise. From the side, just step forward with your right foot, yep, and then come down. You got it, come back and bring your right foot back to your left. And then repeat the other side.
My left side is my
yes.
side.
Yes.
That's my
Yeah.
balance issue.
You got it, that's good. Yeah, yeah. So, and you could do that both sides. You could start from the front, go to the back. You could go to the side. I mean, there's all sorts of different ways you could do lunges. You could do walking lunges. You can go around the track doing walking lunges. Again, if you have knee issues, you're going to have to work up to this. But it's a really easy exercise to get these muscles, going. And again, 10 to 12 times on each leg. So again, with the lunges, you got to do each leg. And make it hard enough that it's difficult and you're good. Posture and balance. I'm going to be a wall for Patty and I'm going to have you just this way. So I'm going to be her wall. I'm going to have you put your arms up. Yep, palms, yep. And then she would slide her arms up the wall. So her hands are right up against the wall and they're sliding up against the wall. Why I love this exercise is because this exercise helps your posture. If I've been sitting at a desk all day with my head forward, my shoulders are rotated forward, this is something I can do. I can just get up out of my desk, do this 3 or 4 times, and it's really good for my posture. Yep, perfect, yep. Yep, and then balance. This is, again, another thing I can do at my desk so I don't have to spend any extra time. Stand up, stand on one leg. How long can I do it? Make a game with myself, do that kind of thing. You can do tree pose, you can do yoga, that kind of thing. But in general, the longer I can stand on one leg, the better my balance is. I can do that on different ways. Okay, finally, weight-bearing exercises. Again, targeted to the hips, wrists, and spine. They increase bone mineral density as we age. If you do them consistently you can actually help your bone building program in addition to your other areas of bone building. Avoid the forward flexion exercises. I'm not a fan of the sit-up, the crunch sit-up. Any jarring exercise if you're untrained. And then any severe rotation. We didn't really talk about that, but sometimes severe rotation, if you've got compression fractures or if you've got, that'll shear the vertebral body. So again, that shearing may not be a good thing. So sometimes that one machine where you do the twisty I don't usually love that for osteoporosis. But outside of that, you pretty much can do everything. Balance training to avoid falls. Look at your home. There's always some different interventions you could look at. Make sure you got lighting, make sure you've got railings, all those kind of things. And something is better than nothing at the end of the day. You know, again, you'll go here, it's like, oh, my head's spinning, there's so much to do. I know, but just do something. You know, if you start today, you do something, it's better than nothing. You know, and if it doesn't work, you get back on the horse, you do it again. You just keep going, but we just need to do it. That's all. And so that's 45 minutes, and I've left a little bit of time for questions. If you have any questions, you ask away. Yes?
I have a question. So basically you said about the sit-ups.
Yes.
It's not really good because, you know, it's like
Correct.
the neck. What if I do the sit-ups first, but I balance that with another activity to open up that?
I don't love sit-ups. So I would say no, but what her question is, so she asked if she does sit-ups, what if she does something more back bend to balance it out? It sounds good in theory, but so when you do a crunchy sit-up, what you're actually working is your rectus abdominis. That's your six-pack. It attaches from my ribs to my pelvis. And again, if it's strong, it may look nice if I have no fat. I've never been in that phase of my life, so I've never seen them. But then, like I said, it's going to pull me this way. If it's doing its job, it's going to pull me this way. So yes, I would have to balance this out to be able to do that. But then again, that's going to create that. So what I like to do instead are more things like Pilates, like so the bicycles, the leg kicks, you know, maybe legs, you know, side to side, you know, leg circles. So keeping my head on the ground, doing those kind of things with my legs, with my breath. So again, I could speak a whole hour on the whole anatomy, but if you exhale and use your transverse abdominis, which is your abdominal muscles, work at the same time. So whenever you're doing these abdominal exercises, you want to be.
What about a plank?
Planks are great. I don't mind planks at all. And again, you'd work up to it. You'd start on your knees. So do you know what a plank is? Would you like Patty to show you? Thank you, Patty. So you could do it on your knees if you'd like. Yep. So this is a plank. So she's working that, and exhale for me. So she's working it. So these muscles are wrapping around and tightening. So she's holding this, and then her abdominals are working. If she gets stronger, she can go on her toes. So it's almost like a beginning of a push-up. And again, blowing. I'm not a timer with planks. I like to think about how many breaths did I do. 6 breaths, 8 breaths, because I like to think about, I always like to think about what I'm working. Does that kind of make sense? Mm-hmm. Okay, thank you.
You do feel those.
Yes.
There's no doubt you feel them.
Yeah, and you could do think about a baby. A baby is a core machine, so when they roll over, they're using their core. When they get on their hands and knees and crawl, they're using their core. So if you do alternating arm and legs on your knees, you're using your core. So there's so many more core exercises than sit-ups. Yeah, and one look on the internet, you'll find a pile. Yeah, yep.
Any other questions?
Oh, sorry.
Well, with the lunges exercise and things like that, can you start out like holding the chair to kind of keep your balance
Yes.
in that? I mean, so
Yes.
then and you will feel you progressing
Correct.
where you could then get off of the chair.
Yes, all of these, just like you can hold. Again, I've kind of, you know, talked badly about these 2-pound weights, but they're wonderful if you've never lifted a weight. Do the 2 pounds. Same thing. If I need to hold on to the chair to do this, by all means. Or I just came off of a meniscal injury or something. Of course, you have to modify until you get the form correct. And if you have any questions, you can see a physical therapist. You can go to a personal trainer. You know, make sure you're safe. But once you do, then the idea of the bone building and the actual bone strengthening, again, that's when you could do these without nothing, with a weighted vest on, with your weights on, with your barbell, that kind of thing, yes. But we all have to start somewhere. Yep, yes.
How many milligrams of calcium should a person have? So after this happens, sorry, I didn't see that there for a second. So after you're 50, you're losing bone mass, but can you replenish any of that with calcium?
So that's a hard question for me, since I'm not a nutritionist, and there's a lot of controversy. So we know vitamin D is one of the issues. You need to get enough calcium and vitamin D, but you may need to specifically get your levels checked and talk to your doctor about what's important. But in this document, you can actually have this one, but it does talk about actual values for vitamin D. So it talks about at least 800 IUs, but I mean, I know I'm on like 10,000. Like, so it depends. I mean, we live in I go to a doctor and I have low vitamin D, so I have to do a lot of, and I have to take it with fat. I have to do drops because my body doesn't absorb the vitamin, so that's a whole other story. So you kind of have to, each person has to individually look at all that kind of thing. And then with calcium foods, calcium-rich foods, like in this document that I'll give you, it talks about different things, like you guys are all eating nuts, there's some calcium in that. Baked beans have some, turnip greens have some, of course your milks and cheeses and fortified orange juice, and so different things like that. But you know, there's definitely different areas, so that's more, and again, like I said, whether it's 1,200, I mean, that's all in there. Yeah, you're welcome. But that's from that, that website that I gave you, that's, that I referenced at the beginning. But yeah, it's a good question, and it's controversial because, again, I often do these talks in conjunction with a doctor who's in integrative medicine, and so that's why I have to be, because some doctors think of it one way, then there's certain doctors that think of it a different way, you know, and then there's the physical therapist. That's why I said, at least as a physical therapist, the exercise stuff is like solid, you know, so, but the other part, you know, we all have to explore that for ourselves. But, you know, we do know we need those minerals. We need vitamin D for sure, maybe some vitamin K, you know, estrogen's another one. I mean, we could talk about estrogen as helping bones. I mean, there's a lot to it, but that's where talking to your doctor about your specific case would be best. Mm-hmm.
Could you share a little bit on recommended screenings for bones? And if there's any self-assessment that we might be able to do to know whether or not we might be, you know, at risk of fractures or...
So I would look at the risk factors, like, so again, you know, the original risk factors, are you female, are you Caucasian or Asian, do you have history of bone density issues in your family, and those kind of things. Have you been strengthening? Did you breastfeed? Are you in menopause? So there's all sorts of things, alcohol, steroid use, cancer treatments, those kind of things. And then as far as screenings, they do sometimes the, you know, the heel screenings at different wellness fairs. I would say that those would be worth it to at least get an idea. But typically your DEXA scan, I read one place where they say they give them at 65. They do give them earlier than that, I think, especially if you're at risk. So, you know, again, a lot of times if you have some of those risk factors and you talk to your doctor and you're over 50, a lot of times you would see if that would be covered. Here, the other thing that's interesting is I wish more of us had a baseline bone density in our 30s, because I've had patients who look normal. You know, of course, we all look normal, but you look at their T-scores and they're -3. And like, again, I think of these women as porcelain dolls. And I think, and they tell me they've skied, they've this. And I'm like, you know, and you think, how long have they been -3? Have they been -3 their whole life? Have they just been -3 for the last year? What's happened? But we have no idea. So we don't know if this is just them, like they're like a bird, or is this something significant has happened? It's too bad that we can't have a little bit better, you know, but I would definitely, you know, if you get a chance to do those bone density like the heel screening, it's something. Sometimes people notice decreased bone density from, let's say, an X-ray, like if they had their shoulder X-rayed, or I mean, I guess the hip X-rayed for maybe they had a fracture or they had some hip pain. The X-ray may show a decreased bone density. The color is different, so that might be a sign where your doctor. It's not necessarily diagnosing it, but it might be a sign that you could discuss with your doctor. It's not a good answer, but it's what we have.
But is there any one of those bone density tests that are kind of like a gold standard?
The DEXA is.
Can you please pronounce
It's called. The initials are DXA, and it's like dual energy X-ray absorptiometry, I believe is what it stands for, and. It's basically like a low radiation X-ray that takes your whole body. They usually look at your hips and your spine. Sometimes they look at your wrists. I've had a few patients who've had total hips that they have to look at a wrist, but typically they look at least one hip and they look at your spine, your lumbar spine, the low part.
that is the one that gives you a T-score?
That is the one that gives you the T-score, correct? Yep. So if that's something that you're concerned about, that is what you would talk to your doctor about and say, am I able to get a DEXA scan? Yep. Thank you very much.